In this third part of our neck lecture, we're going to cover the vessels and the glands, the esophagus and the tongue, and muscles and nodes as well. So let's start with the vessels. We've gone over the internal jugular veins before when we're studying the chest and how they drain the brain and the face, and they come down and insert into the subclavian vein, excuse me. And they are more lateral to the carotids. So they're lateral to the carotids, and there's an internal jugular vein as well as an external jugular vein. And if you'll notice, the internal jugular vein lies along the inside of the sternocleidomastoid muscle, which we'll study later. And here it is coming down from the mastoid process of the ear, and it would go in front of the jugular vein and the carotid artery and come down and attach here to the clavicle and also to the sternum here. So sternocleidomastoid, those three places. Remember, muscles are named after places that they insert into or come from. And then here is another picture of it, but with all of the vessels and everything in place. So here is the external jugular vein and the sternocleidomastoid muscle, which has two branches that come down here to the clavicle and the sternum. And then interior to that and medial would be the carotid artery and the internal jugular vein here that you can't quite see. And that's what they've done here, is that they peeled those outer layers away with the fascia and the external jugular vein and the sternocleidomastoid muscle, and then they've shown you the internal jugular vein and the carotid arteries. So here's a lateral view of this. Looking from the left side, there is the external jugular vein and the sternocleidomastoid muscle, and then deep to that, medial to that, you can see the internal jugular vein, which is posterior to the carotid artery, and you can see the carotid artery as well. And then here's another picture of that with the layers peeled away. You've pulled up the sternocleidomastoid muscle and the external jugular vein, and now you can see the internal jugular vein and how it's posterior to the carotid artery. We are looking at a right lateral image from Netter's. So this is the right side of the patient, and the vertebral arteries come off the subclavian here. They run right up through the vertebral foramen, which are the little spaces in the vertebral bodies, and it goes up. It makes a little bit of a posterior turn around that mastoid process before it goes into the brain. It travels through the C6 through C1 foramen. And then the common carotid artery comes off the brachiocephalic trunk, and it goes up and bifurcates about the level of the hyoid bone. So you can see the hyoid bone here, and the most anterior portion of it is about that same level of the bifurcation of the carotid artery. But again, it's going to depend on each patient and each person and their specific anatomy. The internal carotid artery goes up and feeds the brain, and the external carotid artery goes up and feeds the face. The carotid arteries, again, remember, are medial and slightly anterior of the jugular vein. And the common carotid artery, the internal jugular vein, and the vagus nerve are all contained within the carotid sheath. And we're going to see that on the axial image in Netter's next. And here's that image from Netter's. You've got the internal jugular vein and the common carotid artery and the vagus nerve. They're all contained within that protective sheath there. This is about the level of the C7 cervical vertebra, as you note here. So here we have an image from e-anatomy, a CT scan. We're about the level of the hyoid bone here, you can see that, and the vallicula here, and just about into the piriform sinus. And we have a cervical vertebra, and in the foramen we have the vertebral arteries. And then we have the internal jugular vein and the external jugular vein out here. This small blue dot is the external jugular vein. And see how they are on either side of the sternocleidomastoid muscle right here. So that's the sternocleidomastoid muscle. The external jugular vein runs lateral to it, and the internal jugular vein runs medial to the sternocleidomastoid muscle. And then we have the internal carotid artery and, internal carotid artery and the external carotid artery here. Same thing on this side. Internal jugular vein, external jugular vein, internal carotid artery, and external carotid artery. This will be just a review of the tongue, since we covered it rather well in the first part of the lecture. This is the apex of the tongue here, the most anterior portion, and going more posteriorly, you run into the body of the tongue, and then the most posterior portion is the root, and the root is anterior to the epiglottis. And you've got the median glossoepiglottic fold, which helps to create the vallicula, and you've got the palatine tonsils here on either side. And visualizing the tongue on a MR image from e-anatomy, this is a T2 weighted sagittal MR image. We've got the anterior portion of the patient here, posterior here. This is the root, the body of the tongue here, and then the root of the tongue more posteriorly. The root of the tongue is just anterior to the epiglottis, which is here. The esophagus is just an extension of the pharynx, and it starts at this level here, right about the same level as the thyroid cartilage here. And it is posterior to the trachea. Remember, the trachea has that soft posterior side so that the esophagus can move. The muscles of the esophagus can move as they contract and expand as they are making that peristaltic wave and moving food down into the stomach. You sometimes will see pockets of air within the esophagus, and sometimes that's one way of distinguishing it. If it's difficult to tell if it's the esophagus or if there's something going on within the esophagus or the difference between the esophagus and a node, sometimes the radiologist will have the patient eat a very thick iodinated paste when they're doing a CT scan so that they are able to see the esophagus. Sometimes it's a paste and sometimes it's a thick liquid, but usually it has to be fairly thick so that it doesn't go all the way, slip all the way down the esophagus. And in the CT scan from e-anatomy, we have the anterior side of the patient here, the right side here. We have the vertebral body here, the trachea. We're seeing a little bit of the thyroid gland here, and the little bit of the cricoid is left. Not much, but you see just a little bit of that cricoid cartilage. And then you have the esophagus right in between the trachea and the vertebral body. Remember, they spell the esophagus with the O. This is just a reminder image that nodes are everywhere. I'm not going to ask you to identify nodes on any of the exams. They generally follow the vessels, and they don't normally enhance with IV contrast unless there's something abnormal within them. And the muscles. We talked about the sternocleidomastoid muscle up in the beginning when we talked about the carotid artery and jugular vein. And here's another image of it here in a CT. So it's fairly lateral in the neck, and you've got the jugular vein internal to it and the external jugular vein lateral to it. So internal jugular vein, external jugular vein, and internal carotid artery or common carotid artery here. And so this muscle is fairly thick. It extends all the way from the mastoid process down to the sternum and clavicle. And then you have this very thin sheath called the platysma muscle, and it is very lateral, even more so than the sternocleidomastoid muscle. And it's a very thin, it's almost like fascia, but not. And it's a muscle that extends all the way from the side of the face, and it helps us in our facial expressions, and all the way down into the uppermost portion of the chest. And we're going to see that in the next image. So here on the left we have an image from Netter's, and the sternocleidomastoid muscle runs from the mastoid process here down across the lateral side of the neck. It attaches to the sternum medially, and there's also a branch that goes into the clavicle laterally. So sternocleidomastoid here, sternocleidomastoid muscle. And then lateral to that is, and even more superficial, is the platysma muscle. And it attaches up here on the face and goes down over the chin, down the neck, and attaches on the chest and on the shoulder. So you'll see that it's a very thin sheath compared to the sternocleidomastoid muscle. And the thyroid gland. We're going to talk about all the glands now. The thyroid gland we've talked about a little bit before. It is inferior to the thyroid cartilage. So you won't see the thyroid gland until just the very base of the thyroid cartilage. It's a very large gland. It enhances to a very bright white with contrast, as you can see here in this image. It's on either side of the trachea. It's positioned along the second to the fourth tracheal rings, most of it, and the right and the left lobes are connected by an isthmus. That's this portion here. Sometimes you'll see that the right lobe is slightly higher than the left. That's just very common. And here are a couple more images of the thyroid gland. You can see the thyroid gland here. This is the left lobe and this is the right lobe. This is the isthmus. Oh, try saying that 3 times fast. Isthmus of the thyroid gland that connects the right and the left lobes, the trachea, and the esophagus. And here we talked about sometimes you'll see little bubbles of air in the esophagus, letting you know that that's the esophagus. And there is an image of that right there that's easy to see. And then here's an MR of the thyroid gland. You can see the thyroid gland on either sides of the trachea, and then the esophagus again. On the posterior side of the thyroid gland are the parathyroid glands. They're 4 very small node-like glands that sit here on the posterior side of the thyroid gland, and they are not easily identified in CT or MR unless there is something abnormal about them. And our salivary glands. Our salivary glands are digestive in that they produce saliva to help us digest food. They start breaking down the food in the mouth. The largest of the salivary glands is the parotid glands, and they sit very externally on the sides of the face and down the side of the neck. It's anterior to the ear and down alongside the lateral side of the jaw. So this is the right lateral picture. We're looking from the patient's right side internally, and you can see the external meatus here of the ear, and then you've got the parotid gland just anterior to that. So I don't know if you recall whenever you were sick as a kid and the doctor would reach up and feel for the glands that are right in front of your ear. They would press there, and that was the parotid glands. And then next they would press down the corners of your jaw posteriorly and underneath the jaw slightly. And that's the submandibular glands. And then whenever they'd have you lift your tongue, when they were looking for glands there, those are the sublingual glands. So we're going to look at those other 2 next. But the parotid gland is the largest. It's just deep to the skin and lateral and posterior to the ramus of the mandible. So we're going to get down to the mandible, and that's down a little bit lower, but it's also just lateral to the external meatus of the ear as well. So you can see just the tip of the earlobe here, and this is the parotid glands on either side, right and left. The submandibular glands sit here, just lateral to the hyoid bone. So you can see the hyoid bone here on the CT image, and they sit just lateral to the hyoid bone. I'm having difficulty saying that this evening. They sometimes look a lot like a muscle, so be sure when you look for the hyoid bone that you look lateral to that to see the submandibular glands. This image from Natters is great because you see not only the parotid glands here, just anterior to the ear and just lateral to the ramus of the mandible, but then you see the submandibular gland as well as the sublingual gland. So you get to see all 3 of those on this Natters image. The sublingual is just deep to the floor of the mouth, which is here. So when you lift the tongue up, you can look under here for the sublingual gland. And this last image shows us all three of the glands. You only catch the very tip of the parotid gland here, but then you catch the submandibular glands, and they appear to be a little bit better enhanced than in the last image that I showed you. This is one from e-anatomy. And then the sublingual glands are here, just underneath the tongue. So this is the very base of the tongue, and the sublingual glands lie just underneath the tongue. And then you've got the mandible here. And that concludes our lecture for the neck.